I'd like to welcome Jenny Newman from Home Physio Canada. She is going to be walking us through some education and tips as well as exercises on staying active with lung disease. Without further ado, Jenny, take it away.
Hi. Thanks, everyone. I'm very pleased to be speaking with you all tonight. Um, yeah, I'm going to just give you a little information tonight. Hopefully, you have some good takeaways about the safety of exercise with lung disease and different forms of exercise and what you need to look out for and what goals, intensity, that type of thing. We'll get started here. So, just a quick background about myself. I am a physical therapist. I work one job at the University of Alberta Hospital in Edmonton. So, I do a little bit of work in the ICU. I often see patients with respiratory failure and all different types of lung disease in that environment. And I also work with the transplant program. So, people that are going through heart, lung, liver, kidney transplants. We do a lot of the rehab for that. So that's my work experience. I also have my own mobile and virtual physio company where I see patients in their homes or long-term care centers or whatever environment that's outside of the hospital. And I also do some virtual rehab with that. And you may have seen me in the past. I've done a couple guest appearances with the Alberta Lung Association with some educational stuff as well. So, okay, we'll get going here. So, I want to start by just teaching you a little bit about how we breathe, what muscles we use, what structures are involved. We'll just kind of talk about the main ones here. I'll get my little laser pointer out. So, with breathing, obviously, we bring air in through our nose or through our mouth up here, goes down through the trachea and into the lungs. The lungs and the lung tissue is where the gas exchange occurs. So, that's where oxygen comes out of the air and into the lungs, circulates through the bloodstream. And that's where carbon dioxide leaves the bloodstream, goes back through the lungs, and out through the nose or mouth. Okay. This is a pretty simple picture, but hopefully you kind of understand that sort of air intake process. Down here, we have our big, giant diaphragm muscle. That's one of the main muscles used in breathing. Um, I'll show you a little bit of a video soon, but this diaphragm muscle is pretty important. It actually makes up about 70% of the force when we inhale air. So how does that kind of play in when we've got lung disease? Well, often lung disease affects the lung tissue itself. So it's important for us to address some of these other structures, the muscles specifically, so that we can kind of keep our muscles strong when our lungs are not working as they should. Okay. This one's a little bit more anatomical. Hopefully that doesn't scare anybody. But this is a picture if we're looking at our rib cage with the lungs removed. So down here is the bottom of the rib cage. See that diaphragm down there? That's that big flat muscle that we use when we do a nice deep inhale, the diaphragm contracts. And when we exhale, the diaphragm relaxes. So that's the main muscle of breathing. We also have some smaller muscles that help us. These intercostals, we have external and internal. Don't get too caught up on what that means, but basically, we have muscles in between our ribs that help to move our ribs and move our rib cage so that our lungs can actually expand, so we can take deeper breaths. And lastly, up here, these little guys here, the scalenes, the sternocleidomastoid. I'm not going to test you on the names here. These are these muscles up in our neck. So if you go like this, you can see how my neck tenses up. Those muscles there are our accessory muscles. They help pull on the rib cage. And again, they help move the rib cage so that we can expand our lungs.
Um, Jenny, sorry to interrupt, but could you do that again? The recording session didn't capture that movement because it was so quick.
Okay, sure. So when we do this, you can see how I'm tensing up my neck here. Those muscles there, those attach onto the ribs, and those muscles help move the rib cage so that we have more room for the lungs to expand and breathe. These muscles are really often recruited and used in patients that have lung disease because we're kind of using a last ditch effort, everything possible to really get those deep breaths happening. So those muscles up here in the neck, those ones are considered accessory muscles. Those ones are also part of breathing. They're just not often used in regular, normal, relaxed breathing. Okay. So I have a little video here and it goes pretty quick. So I'm going to try to kind of start and stop it a few times. So this video is a representation of our lungs and our diaphragm. Okay. So we can see, where did my pointer go? Here. We can see our lungs here. We can see the trachea, the windpipe. That's where the air comes in, down into the lungs. And then this big guy here is our diaphragm, that flat muscle. Okay. So when we inhale, the lungs get bigger. They get pulled downwards as the diaphragm contracts. When we exhale, the opposite happens. The diaphragm moves up and the lungs get smaller and the air leaves the lungs. We're going to do that again with some more words here. So as we inhale, the diaphragm down here contracts, the diaphragm moves down, the lungs get bigger and move down as well. As we exhale, the diaphragm moves up. Okay, so down here, diaphragm starts to relax, moves back up towards the lungs, pushes on the lungs, and that's how air leaves our lungs. Okay, I'm going to let this play through a few times so you can kind of see what happens. Inhale, the lungs have air in them. Exhale, the air leaves the lungs. Okay, this is going to play on a loop, and I'm just going to talk for a little bit here. So why is it important for you to know what muscles we use and how the lungs work? Because when you have lung disease and your actual lung tissue where we get oxygen out of the air, if that is affected and we can't get as much oxygen from regular breathing, what other structures can we train? What other things in our body can we do to make our breathing stronger? If our lungs aren't working properly, how else can we breathe better? Okay. Does that make sense? Hopefully. Okay. So we're going to leave the anatomy piece for a little bit here. Hopefully you all got to visualize how your lungs and diaphragm work when we breathe. So I want to just chat a little bit about energy expenditure here. So exercise isn't always about going into a gym and lifting weights. Okay. Every time we move, every time we expend energy, that needs oxygen. We need oxygen to do our regular body processes. We need oxygen for resting metabolism. And then for things like physical activity. So that more traditional exercise, getting up and going for a walk. Okay. So how do we measure energy expenditure? Calories is a common one. Most of you have probably heard of that. Calories is an estimate. Measuring activity volume. So this is things like step counters, right? If you have a pedometer, smartwatches can count your steps. This is also when we count our sets and reps. When we're doing a workout and we're going to do 3 sets of 10, we're measuring the volume of activity we're doing. You can also measure time or distance. Okay. You can use heart rate as a measure. That one's a little more scientific, and you often need a device for that, a heart rate monitor, a watch, or a special heart rate strap. But the one that we use with the transplant program and in somewhat more medical settings is called metabolic equivalent of tasks, or METs. Okay. So what METs are, it's a really simple way to estimate how much energy we need or how much energy we're going to use to perform a certain task. Okay. So this table here, someone along the way has gone and determined with a scientific equation based on body weight and age and gender and all of those things, someone has gone and come up with values for how hard certain tasks are. Okay. So this table here, um, we have the full spectrum. You've got everything from a MET level of 1, where you're walking, driving, brushing your teeth, sitting and eating, all the way down to a MET level of 9 or 10. So those are those really vigorous, high energy output types of things, running, jogging, gymnastics, those types of things. Okay. I'm going to touch on this a little bit later, but generally with any type of exercise and activity, when we have lung disease, we want to stay on the low to moderate end of things. Okay. So we want to kind of be around 4 or less for our MET levels. Now, that being said, day-to-day life, you might have to go and move some furniture. So, this gives you a picture of moving heavy furniture is a pretty high MET level, 7 to 8. So that's going to be very intense. That's going to be very energy consuming. This is going to kind of set us up in a few slides when we talk about prioritizing our activity. So I just want you to have a little bit of a background on what I mean when I'm talking about METs and MET levels. And a table like this is actually really easy to compare different activities. So if you're a cross-country skier and you want to continue cross-country skiing, you know that you're probably going to be on this higher energy expenditure spectrum. Okay. So activities of daily living, you may have heard this term at some point, but we have basic activities of daily living. So these are those skills that you need to be independent. Okay. These are things like walking, bathing, eating. All of these tasks all consume energy. So they all have a MET level. We also have instrumental ADLs. Okay. And those are those more sort of complex organizational skills. These basic versus instrumental have nothing to do with energy expenditure. It is more, like I said, how to maintain your independence. Basic ADLs are those independent skills. Instrumental ADLs are the more complex skills. Okay. So having lung disease can limit the energy you have available to do your ADLs. And I am sure a lot of you have experienced this on different degrees. When you can't breathe, it's pretty hard to do things around the house. Vacuuming and sweeping can be really taxing, shoveling snow. Okay. For some people, sitting and eating is absolutely draining, and people need to rest after they've sat and eaten. So this kind of sets you up to understand that when we're talking about being active and staying active, again, not always just a specific exercise, but our daily life, what keeps us active, and what types of things do we need to be able to do to care for ourselves. So if we're going to sort of, think about how lung disease is going to limit our energy for our daily tasks, we want to kind of plan accordingly. So sometimes you're going to need to take more time and more effort to do your basic ADLs. Might take you 20 minutes to get dressed. Okay. So plan that out in your mind. Your BADLs, your basic ADLs, you want to do those before your ADLs, before your instrumental. So you're probably going to want to get dressed before you go grocery shopping. Most people would anyways, okay? And then you want to try to plan your more energy consuming tasks first. If you know that you have to vacuum the living room and you also have to organize some papers, the vacuuming is going to take a lot more energy than organizing papers. So if you do your organizing first and you use up too much energy doing that, you might not make it through the bigger vacuum task. Okay. So try to do the bigger, more energy consuming tasks first. Plan to do big tasks on different days. If you have to mow the lawn and clean the kitchen and go grocery shopping, those are pretty energy consuming things. You probably are not going to be able to do all of those on one day if you have, pretty moderate to severe problems breathing. So plan so that you don't do very heavy, intense, energy consuming tasks all on the same day. Give yourself some rest. Plan for success. Okay. And prioritize. If you absolutely don't need to cut the grass and you absolutely do need to go grocery shopping, you're out of food, probably do your grocery shopping first. The grass can wait. Okay. So, if we're going to talk a little bit just about modifying the activities themselves, a few easy ways to do that is breaking those tasks into smaller parts or smaller tasks. If you have to mow the lawn, do half of the front, then take a rest, then do the other half, then take a rest, then go do the back. Okay, some of these might seem really kind of second nature, but for a lot of us, we actually don't, we may not see things that way. You might see, oh, I have all of these tasks I have to do. I have to, make dinner and drive and go pick somebody up or whatever it is. Sometimes if we just kind of take a moment to figure out how can we make this easier on ourselves so that we're not so stressed out, this can be a really helpful way to get through a lot of your daily tasks. Okay. You can perform part of the task with rest between. This is stair climbing is kind of a good place to think about this partial task completion. So if you have your bedroom upstairs and you've got 2 flights of stairs that you have to get to the bedroom, you can try putting a chair in the landing if you have a little landing in between the stairs. You can just simply stand and take a rest halfway up the stairs if you need to. So just kind of building rest into whatever task you have to do. Changing your body position can also be a really easy and effective way to give yourself a little bit more energy. If you're making dinner, you're chopping vegetables, maybe do that sitting down instead of standing. Okay. And of course, the last one here is ask for help or delegate or hire. If you have priority things like getting dressed and feeding yourself, other tasks you may not have the energy to do. So this is where we can call on friends and family, or we can hire a landscaping company or whatever it is, cleaning company, or delegate someone in your household. Say, hey, look, I'm running out of energy here. Can you maybe sweep the floor for me? Okay. Sometimes easier said than done. I realize that. I have kids myself, so might have to offer a little incentive sometimes. But nonetheless, there are ways to modify the activities that we have to do so that we have more energy and feel better about getting through those tasks. Okay. So that's kind of, goes through the activity and task and energy side of things. Now I want to talk to you a little bit more specifically about exercise itself. So these are some common questions that I often get, I often hear. Should you exercise when you have lung disease? Is it safe? Is it okay? What should you monitor? How hard should you be exerting yourself? And what forms of exercise are best? So we're going to go through each of these one by one, and we'll kind of tease out some specific examples and some specific ideas so that hopefully you can either maintain or maybe begin an exercise program on your own and have the confidence to be able to do that. Okay. So, absolutely. Should you exercise? Yes. I hope that you all had that answer in your heads. There are so many reasons to exercise, but the main ones that I wanted to just touch on, especially when we're dealing with lung disease, is the top one here. Exercise can actually improve your lung capacity and your respiratory muscle efficiency. So when we think back to that video of the lungs expanding and contracting and the diaphragm pulling down so that we get deeper breaths, When we exercise, we're training those muscles. And so muscles that are trained, muscles that are stronger, are going to be able to pull on the lungs more so that we actually have more space to breathe. Those muscles in between the ribs, those little rib muscles here, those muscles, when they work better, when they're more strong and have better endurance, we can actually move our rib cage more, which allows the lungs and the lung capacity to increase a little bit. One of the biggest things that I often see for patients who have had a lung transplant is people don't often understand why, as soon as they get their new lungs, they all of a sudden can't breathe perfectly. Well, think about your muscles and the musculature that you have. Those respiratory muscles, the big diaphragm, those little intercostal muscles in between your ribs, and those muscles in your neck, those muscles are only able to work as hard as your lungs with lung disease can work. If you replace the lung tissue and the lungs, your muscles are still all the same. So they are only going to be as strong and capable as what you've trained them to be. So if we don't do breathing exercise and muscle exercise and we don't train those muscles, then it gets really hard to breathe. And even replacing the lung tissue itself isn't an instant fix for all of a sudden feeling that relaxed breathing state. Okay. So that's why, you know, big yes, we should exercise with lung disease. And we can actually prolong some of the decline from lung disease as well. And that's the same reason I just spoke about the respiratory muscles. Okay. So being able to move the rib cage better, being able to move the diaphragm better. And of course, you know, overall health and wellness of the rest of your muscles, not just the breathing muscles. So that kind of brings me to the next point. Another reason to exercise is to maintain muscle mass, and your functional strength. So not just the lung and respiratory muscles, not just the breathing muscles, the rest of the muscles in our body. Okay, when we think back to those ADLs, the tasks that we have to do, the activities that we have to do. If our body is limited by breathing, we can strengthen our muscles so that it makes tasks easier because stronger muscles can do things easier. If you have more strength, it's going to be a lot easier to carry a bag of groceries than if your arms are very, very weak. This goes the same with moving around in bed, getting up and walking. If your legs and your core muscles, your stomach muscles, your back, all of that, if those are really, really weak, then it becomes hard to do those basic tasks, those basic activities of daily living. It's hard to get dressed if you don't have the strength to put your pants on. Okay. So exercise helps us to maintain overall muscle mass and functional strength. And then the last one here, this is a huge one. Exercise helps to decrease stress and anxiety. This has been proven time and time and time again. I have yet to meet a patient with lung disease who doesn't experience some form of anxiety or stress when they can't breathe. Just life in general can get very stressful. So exercise is a really, really great way to balance that. Exercise releases all kinds of wonderful endorphins and neurochemicals and the circulation, getting the oxygen moving through our body. That all can be a really powerful tool when we're anxious. And breath work specifically, specific breathing exercises are absolutely remarkable for reducing anxiety. We'll talk about that in a bit. Okay. And of course, there's many more. Exercise helps with detox and helps with living longer and helps with managing inflammation in the body. So all kinds of wonderful things. Okay, so what should we monitor during exercise? There's a few different ones I've listed here. And these are not things that you absolutely must pay attention to, but these are just a good idea. If you have the equipment and if you have the ability to check in on some of these vital measures, then these are what we often look for when we're working with patients at the hospital. Blood pressure, that we do before and after. Heart rate can be before and after or during. Oxygen saturation, and rating of perceived exertion or breathlessness. So we'll kind of go through those one by one, and I'll give you a bit more information on each. So blood pressure, okay? This over here is that traditional blood pressure machine you've probably all seen. Hook it up to your arm, usually your upper arm, push the button, and away it goes. So normal blood pressure for most people is 120 over 80. That top number is the systolic number, 120. And that's the pressure when your heart is actually pumping and contracting. Okay. Um, that number will usually go up a little bit with exercise. The bottom number, that 80 on the 120 over 80, that's your diastolic blood pressure. So that's the pressure when your heart is relaxing. So systolic is the pump, diastolic is the relaxation. Okay. Diastolic will often go down with exercise. So we typically want you to look at your blood pressure before and after because we do have some cutoff numbers here. If your blood pressure is really, really high or really, really low, it is not a good idea to proceed with exercise. And all of the information that I'm going to talk about tonight, I should sort of preface this with the fact that I hope that you're in contact with your doctor and going to let your doctor know, hey, I'm going to start an exercise program, your pulmonologist or whomever. Because you might have a little bit of high blood pressure at rest, and that's okay. But we want to make sure that you're not really crazy high because that can cause, make you at higher risk for things like cardiac events and strokes and that type of thing. So when should you not exercise? If your systolic blood pressure, so that top number, if it's below 90 or above 160 at rest, that's when you're completely resting, you're not moving, you're not exerting. Now, that being said, some of us, especially people who are a little smaller, who have smaller body stature, sometimes they'll have a little bit lower blood pressure. So your resting blood pressure might be in the 90s. You might be like 94 over 60. That's okay. That's why you're going to check with your doctor before you begin an exercise program, just to make sure, like, hey, is this, 90 systolic blood pressure, is that safe? And then on the other end of things, the diastolic, that bottom number, you don't want to be exercising if that's too low, so below 50, or if that's too high, above 110. And again, this is at rest. Okay. Signs and symptoms of some of those blood pressure issues. Low blood pressure, you'll feel a little bit dizzy or lightheaded. So if you feel a little dizzy or lightheaded and you're going to start an exercise session, might be a good idea to check your blood pressure before you do that. Drink some water if your blood pressure is a little bit low. That can help to bump things up. And headaches can indicate high blood pressure. So again, we definitely don't want to exercise if our blood pressure is very, very high, because oftentimes exercise will increase our blood pressure a little bit because the heart is pumping faster. So the whole system pressure is a little bit higher. Okay. Heart rate. Keep an eye on my time here. Heart rate, normal sort of average heart rate is anywhere between 60 and 100 beats per minute. Again, that's at rest. Okay. Lots of different things can influence your heart rate: medication, stress, dehydration. But when we exercise, our heart rate will usually go up about 10 to 20 beats a minute, depending on how hard you're working. That's kind of a good sort of goal, is 10 to 20 beats a minute. Now, I don't want any of these scientific numbers and equations to scare you, but I did want to put a little bit of information here on sort of parameters for heart rate and how high is too high, and sort of looking back at those MET levels and energy expenditure. How hard should we be working with exercise? We can use heart rate as an indicator of how hard we're working. So this is a formula we often use in medical settings, is we're looking at your predicted heart rate max. So we're looking at what would your predicted maximum heart rate be for your age, okay? So for someone who's 60 years old, it's 220 minus 60, okay, 160 beats a minute. So that's what your predicted maximum heart rate would be. Some people who are really well trained and exercise a lot, they have a higher maximum heart rate than that. But the reason I want to just tell you about maximum heart rate is because if we know what our predicted max heart rate is, then we know how high, if our heart rate gets too high, when we should stop. So we generally want to stay kind of below 80% of our predicted max heart rate. Okay. So going back to the example, if you're 60 years old, we're going to assume your predicted max heart rate is going to be about 160 beats a minute. 80% of that 160 beats a minute is about 128 beats a minute. So we're looking at about 138 beats, or sorry, 130 beats per minute. So we want to keep our exercise below 130 beats per minute. And again, the reason we want to keep our heart rate on the lower end is we don't want to overstress the heart because of our lung disease. So if your lungs aren't able to get the oxygen to the working muscles, your heart is going to want to compensate. And then your heart starts going way too fast and it's pumping and pumping and pumping and pumping and pumping. That's when we can start to get into the scary neighborhood of things like heart attacks and strokes and atrial fibrillation, that type of thing. So just for safety and to protect your heart, we want to try to stay below our maximum heart rate. We want to be kind of around 80% of our maximum heart rate or lower. Okay. And like I mentioned before, everyone's going to be a little different. If you have done a lot of physical work in your life and a lot of physical exercise and you have a higher heart rate, a higher max heart rate, you might be able to tolerate a little bit higher intensity activity. But in general, dealing with lung disease, we don't want to go too crazy with our heart rate, okay? Oxygen saturations. So I'm assuming most of you know about this. This is basically the oxygen circulating in our blood, okay? So healthy lungs will usually be around 95 to 100%, okay? When we are exercising with lung disease, our goal is to be above 90. If you are a COPD patient, then we want to be between about 88 and 92. Okay. So these are not hard, fast numbers, right? If you drop to 86 or 87, maybe slow it down a little bit. Okay. You can use something like this finger probe while you're exercising to check what your actual oxygen saturations or your SATs is what you'll hear them called often. Using a finger probe is a really easy way to just kind of keep in check how much oxygen is circulating through your body. Okay. And again, going back to the example with heart rate, if we have too little oxygen circulating, the heart is going to try to overcompensate. It's going to start pumping too hard, too fast, too much exertion. And again, that's where we get into risking some of those cardiac events. Okay. So, if you're exercising, you're looking at your oximeter and you notice that you're kind of down around like 86, 87, it's probably a good idea to either stop and rest, do some breathing, or to just scale back the intensity of whatever you're doing. If you're walking, maybe slow it down a little bit. If you're cycling, maybe take a little rest. Okay. And I also want to say on this topic of oxygen saturation, don't focus on the number strictly. Think about your symptoms. Just because the finger probe might read 86 or 85 or 84, you might be getting really good breath. It might be just a little bit of movement in the finger probe causing some of those numbers not to read that accurately. And aside from that, we don't want you to be so focused on the numbers that you don't allow yourself to experience a little bit of exertion here and there. Some patients that I find that go through the lung transplant process, they get very, very focused on their SATs. They always want to have their SAT monitor on. They always want to know what's happening. They always want to see those numbers. And the only problem with that is that There are other factors like our muscles, our diaphragm, our accessory muscles that help with breathing, but that can also make us feel breathless. So if we're feeling breathless and the numbers aren't looking great, then definitely scale back, give yourself some rest. But if your numbers are looking a little bit low and you feel pretty good, then, carry on, but keep a little bit of an eye on those numbers. Okay. Um, and this is a really good table. I like this quite a bit because we can kind of compare breathlessness and exertion. So this is that rating of perceived exertion, rating of yourself, how hard you feel you're working. And we want to kind of keep you in this low to moderate category. Okay, so you're going to be kind of moderate or somewhat breathless. You're doing a moderate or a somewhat strong effort. Getting up into these higher intensities, these higher efforts, and these higher breathlessness scales, um, once in a while is okay. And especially if you're supervised, it's okay. But if you're exercising on your own and you're starting to feel really breathless, you're at a 6, and you're like, oh, maybe I'm gonna, turn up the intensity on the treadmill. I'm gonna increase the incline. And then you're going, okay, now I'm really, really breathless. I'm really working hard here. If you're on your own, that can be a little bit dangerous, right? If you don't have someone nearby to help, if you were to fall or collapse or something like that. So we really recommend, given the fact that your lungs are not going to be working the same as someone without lung disease, we want you to stay to that low to moderate intensity when you're exercising, especially when you're on your own, when you're not in a medical setting where we have access to, everything we need for resuscitation purposes. So low to moderate exercise, that is key. Okay. And again, if you're an experienced exerciser, have been involved in fitness and sports and whatever, you can definitely take those numbers a little bit higher if you feel confident doing that. But I'm kind of speaking in general terms for most folks that aren't regular exercisers or don't have a big background in the gym, that type of thing. So this kind of is just a little bit of a refresher. Low to moderate intensity is what we're looking at here. Okay. Your blood pressure should not be over 160, over 110, shouldn't be higher than that at rest. So you should not start exercising if you check your blood pressure and you're 200 over 120. Okay. Heart rate, we don't want you to be going past that 80% of your predicted max. Once in a while is okay, but in general, your long-term exercise, your consistent exercise should stay 80% or below of that heart rate max. Oxygen saturations, we don't want them going below 88% for very long. If you're a COPD patient, if you're other types of lung disease, usually we aim for 90 and above. Breathlessness and effort, we don't want you up in those high neighborhoods, right? We talked about that 3 to 4 out of 10, but definitely we don't want you up here at 7 or 8 out of 10 if you're inexperienced and if you're unsupervised. MET levels, metabolic equivalent of tasks, that first chart we looked at, we want you in that kind of moderate window. Okay. And more experienced exercisers can go a little harder if the doctor thinks you are safe to do so. Okay. Trying to speed up a little bit here. I know we started a bit late, so we're cut into a little bit of time, but supplemental oxygen and exercise. Yes, it's safe to exercise when you're on oxygen, but there are some things that we need to consider. Like when I work with patients at the hospital, we exercise people who are on ventilators. It's not the same as what the exercises you would be doing, but absolutely, supplemental oxygen is just one more way to give us, better breathing capacity. If you're on really, really high doses, you might want to consider a supervised exercise program. So those are, kind of above 10, 15 liters a minute, something you can discuss with your doc. Adjust accordingly. I find when I work with patients in the hospital who are on supplemental oxygen, we get much better results in doing some deep nasal breathing rather than going and turning up the dial on your concentrator or on your oxygen tank. Nasal breathing we'll talk about in a little bit, but deep breathing in itself, just helping to really get more air, can be just as effective as giving yourself an extra 1 or 2 liters of oxygen. And that's just because when you slow down your rate of breathing, those oxygen molecules have more time to exit the breath and enter the blood. So slow, deep breaths are very, very important if you're on supplemental oxygen. And then you also want to consider your environment that you're going to be exercising in. Are you going to be tripping or getting tangled up on your court? Are you planning to go swimming? If so, how do you do that with supplemental oxygen? Not so easy. If you are going to be out and about and you've got a portable device, are you going to run out of oxygen? How much oxygen do you need while you're exercising? Plus the trip, getting there, plus getting home. So there's a lot of different things to consider. If you're on higher doses, you may want to use a mask, just like a regular mask or a non-rebreather mask instead of the nasal cannula, because as you go into some higher doses of oxygen, it can be really uncomfortable and really dry out your nose, especially when you're huffing and puffing and breathing and moving in it. Lots of things going on there. Okay. So coming sort of to the end here, what types of exercise are best? We'll go through each of these one by one, and then hopefully we'll have a little bit of time at the end for some questions, okay? So breath work is super important, resistance training, cardiovascular training, and then mobility and stretching. So breath work, this is a really hot topic nowadays, and it has so many uses. And I don't think we often have enough information or enough proper knowledge about how powerful our breath work and our breathing can be. So breath work is basically just any kind of focused effort on breathing. It can be with moving your body for something like yoga, or it can be without moving your body, something like meditation. Okay. What we're trying to do with breath work is we're trying to train and control the diaphragm and the breathing muscles so that we can really maximize how efficient that oxygen moves through our body. One of the big hot topics nowadays is breath work for anxiety. And again, patients with lung disease often do have anxiety here and there when they can't breathe. So we have some set pathways and neurons and groups of nerves in our brain and body that can actually trigger relaxation when we do breath work, especially when we breathe through our nose. And this is just something we're born with. So breath work can be really powerful for reducing anxiety, reducing stress. Okay. A few tips on breath work here. You want to take a really deep inhale and a really slow exhale. So if you've ever heard of belly breathing, that's what they teach in yoga. Belly breathing essentially is just learning how to move your diaphragm better and how to use your diaphragm when you inhale, right? Our diaphragm is that big flat muscle that sits under the rib cage that pulls down when we inhale. So if your belly sticks out when you inhale, that's a pretty good indication that you're using your diaphragm and that you're able to really expand that muscle so that we can pull our lungs down and get as much lung expansion as possible. Nasal breathing is often advised and better than mouth breathing. Breathing through your nose can help to filter some toxins and irritants when you're inhaling. And nasal breathing is also more efficient. I'm not going to get into the science of it, but it's basically just the pressure airway system. Nasal breathing is better. Okay. We don't have enough time to go through exactly specifically why. Pursed lip breathing. So that's when you make your mouth into a tiny little O when you're exhaling. Okay. So nasal breathing and pursed lip breathing go together to this nice little phrase, smell the roses and blow out the candles. So when you're exercising, think about deep breath in through the nose and Nice tight little circle for your mouth when you exhale. Okay, smell the roses, blow out the candles. And we also want to be careful that we don't hyperventilate or overbreathe because that can actually add to how much carbon dioxide we have in the system. And if we have lung disease, chances are your body is not going to be ridding carbon dioxide as best as it should. So hyperventilating and overbreathing, breathing too much too fast, can make that situation a little bit worse. Okay. Resistance training. So this is basically any kind of movement where we are moving against force. That force can be a weight, a TheraBand, a gym machine, body resistance, water, any number of things that you are actively working against a force. This doesn't just mean gym exercise. Going back to our ADLs, right? Raking is resistance training. Shoveling, you're lifting a load. Moving furniture, carrying groceries, gardening, you're digging, you're pulling, you're weeding. You've got forces involved that you're working against. Resistance training is crucial because it's what actually builds our muscle strength and builds our bone density. So bone density is super important for making sure we don't just have random fractures. I have seen so many people fall just from a standing height. I've done it myself actually. When I was younger, I fell running in gym class and I broke this wrist because I had very poor bone density at the time. So resistance training adds force through the bones, and that's what actually makes your bones denser and stronger. Resistance training also helps so that we move more efficiently. When our muscles are stronger, we move our bodies better. Okay. And of course, reducing falls. That's a big one. Okay. So resistance training really kind of the take home here is we move more efficiently when we have stronger muscles. So we can move better with less effort. Okay. Tips on resistance training. So we really want to go for movements or exercise that mimics real life activity. So functional training is what that's one of my most often, almost not even often, that is always the type of exercise that I will teach people to do. So what exactly does functional training mean? Well, if you go to a gym and you sit in a traditional gym machine, like a chest press where you've got the bars that you kind of have to push forward, that's not a functional, that not considered functional training because it's putting you through a very set movement pattern. So you're not using any of your accessory muscles. You're basically just isolating one movement, one muscle, and it doesn't really translate into day-to-day strength. It will make your muscles stronger. You will be stronger overall, but there's a better way to do things. We want to train movements that we would do in real life. So sitting and standing, how many times do you get in and out of a chair every day? How many times do you get on and off the toilet? If your leg muscles are too weak to do that, that is the perfect example where functional training can help. We train that sit to stand movement. You can start from a higher seat and gradually get lower. There's lots of different ways to modify functional training patterns. There's lots of different equipment. I could talk for hours about this subject, but basically, if you're going to choose resistance training, try to do exercises or movements that mimic real life movements. Okay. When you're breathing, when you're doing resistance training, good idea for breath patterning. You want to try to exhale when you exert. Okay. So if you're going to do a chest press, I'm just doing one arm here. Can't really see that. Okay. So the exertion is when I'm pushing. Okay. I want to use my breath and exhale because that exhale with exertion, that allows us to use our abdominal muscles, which is considered an accessory muscle. If we think back to those first few slides on anatomy, we can actually use our abdominal muscles to help get the air out. So try to exhale when you exert. And then how much resistance training, how much volume, how many sets and reps should we be aiming for? Generally, we want to think about muscle endurance. We want our muscles to be able to last longer during tasks. We want to really maximize that oxygen transport. Okay. So anywhere between 2 or 3 sets. Sets is just a group of repetitions. Reps is a repetition. How many times you're going to do that movement? If you're going to do a shoulder press, 1 rep, okay? A group of 10, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 is 1 set. Okay. So we're kind of sticking with that low to moderate intensity if we are looking for muscle endurance and if we're looking for that sort of 2 to 3 sets of 10 to 20 reps. Okay. Oh boy. Cardiovascular exercise, sustained repetitive movements. Okay. Walking, running, cycling, rowing, those types of things. These are where we're doing something in a similar movement pattern for a long time. This strengthens our oxygen transport system. So this strengthens our heart and our circulatory system. It helps our diaphragm and our respiratory muscles to become more endurant so that we have, more capability to do an activity for a longer period of time. Your goal with cardio is to go for a little bit longer duration, right? We want to go for anywhere between 10 and 30 minutes, maybe even more. But again, low to moderate intensity. Add rest breaks if you need to. If you're going to ride a stationary bike and your goal is to do 10 minutes, you might only be able to do 2 minutes at a time. So do 2 minutes, rest a bit, 2 more minutes, rest a bit, 2 more minutes, and so on. Try to choose weight-bearing exercises instead of non-weight bearing. So when you're actually getting some force through the muscles, or sorry, through the bones. So something that's standing is going to be weight-bearing versus something that's sitting is non-weight bearing. And then consider your safety, right? Lots of different forms of cardio exercise. Contact sports may not be the best option if you have an oxygen tank with you. Um, Indoor versus outdoor. Are you going to walk on a treadmill or are you going to walk outside? What is safer? What is easier? What gives you the ability to control better? Lastly, we're going to just touch on mobility and stretching. So mobility is more thinking about the joint and how much movement we have at a joint. And stretching is more tissue length or tissue pliability. So range of motion, we want to kind of repeat those movements. Stretches, we want to hold those movements. Okay. So thinking about lung disease, it's really important that we address our thoracic muscles. Okay. So those are the muscles up in your spine and your mid back around your shoulder blades. Those muscles, because that's where our lungs are, we need to have the ability to move freely with those muscles and in our spine. So we actually want to be able to do stretches and mobility exercises that can give you better movement in your spine and in your shoulder blades so that we have more room to move the lungs. Stretch when your muscles are warm. So after a little bit of light exercise or heat, stretches should be held anywhere from 10 to 30 seconds. Muscle tissue itself needs 5 minutes a week in order to get more length out of it. So if you're planning on stretching and you want to actually improve your flexibility, you need to hold that stretch for 5 minutes a week. That does not have to be at the same time. Range of motion exercises, those are those repeated movements around a joint. They should have no resistance. And again, you're looking for high repetitions. So no resistance, no weight. Range of motion in your thumb would be just as simple as thumbs up, thumbs down. Okay. That would be range of motion. Stretching the thumb would be holding. Hold, 10 to 30 seconds. Okay. Really important that we do some stretching and some mobility for our neck. And like I talked about, the thoracic spine, the muscles at the back, just because of how our lungs sit. And those accessory muscles here, we want to stretch those and train those as well. Okay, other wellness considerations. Again, this is a whole topic for a whole nother day, but nutrition, make sure you're getting enough protein, hydration, water, and electrolytes. Electrolytes is what our brain and our nervous system functions with. Sleep is very, very, very important. Stress and anxiety, we need to address that. And your social support. Okay. So I'll just touch really, really quickly. Through my company, Home Physio, we are going to be offering some pulmonary rehab programs in a virtual setting in the new year. So a lot of what I talked about today is just going to be way more in depth in the rehab program I'm going to be offering in the new year. So if you do have any questions about that, my email is on the next slide. You can reach out to me for any more additional information on that. Today's session in an hour, I'm hoping that you got a little bit of some good information that you can use. Um, but these topics are so broad, and I think that people living with lung disease really need to understand how their body works and what factors that they can control to help maximize their own health when your part of your body is not healthy. So this was just a little bit of a piece, a little small picture of things to consider with exercise and activity, but it is really such a huge topic that I could talk for hours. Okay. So that is hopefully, I didn't take you too long. That is the end of my presentation. I'm not sure if we're going to open it up for questions. I don't know if we have time or whatnot, but I will turn it over to Jamie.
Thanks so much, Jenny. I think we can maybe have 5 minutes for questions. If anyone has questions, you can unmute yourself. Um, does anyone have any questions or comments? Let's see here. So I've got one from the Facebook Live link.
Okay.
They are wondering why nasal breathing is better than mouth breathing.
Okay. So when you breathe through your mouth, you often dry out a lot of the structures in your throat and down into the trachea because it's a bigger space. Okay. It's a lot bigger of a hole. Nasal breathing, specifically, we filter the air a lot better when we use our nose to inhale. So sometimes the air is full of contaminants and pollutants. And when you use your nose to inhale, because the track is longer, we have a greater distance from our nose down to our lungs rather than our mouth down to our lungs. That additional time helps to filter out some of those pollutants and irritants. It also helps to warm the air a little bit better. So we get a little bit better of a, because the pressure difference outside of our bodies and inside of our lungs, we can get deeper breaths with the nose rather than with the mouth. Okay, because with I'm not great at explaining the biomechanics of this, so forgive me. Hopefully, this makes sense. Um, but it's the same idea as, let's say you're using a garden hose and you put your thumb over the end of the hose. The pressure increases, so the hose will spray faster. When you use your nose to take an inhale, the holes are smaller versus the mouth hole. So the pressure is higher, so you can get more air in through your nose and you can get that air deeper. So generally, nasal breathing is preferred because we can take deeper breaths and because we clean and warm the air a little bit better versus than your mouth. Hopefully that made sense.
Okay, great, thanks. Okay. Well, there's one more question on the Facebook Live link. Nasal and pursed breathing. When I try to do nasal breathing and then pursed breathing right afterwards, I find myself actually getting short of breath. Am I over breathing?
That's a good question. So sometimes breath work is going to feel very unnatural. Sometimes that's because we're recruiting some of those breathing muscles that are a little bit weak. Um, Over breathing is more the rate of breathing. So, how quickly you're breathing. So, generally, if you're going to do the nasal breathing and the pursed lip breathing, that typically tends to slow our breathing down. So, generally, we wouldn't be over breathing if we're doing that breathing pattern. However, if you're just learning some breathing exercises and some breath work, and you're just starting out, you might feel like you're not getting enough air. You might start to get panicky and you might start to hyperventilate and breathe a little faster without even realizing it. So, a good sort of thing to do if you can is um, just try to be as relaxed as possible and try to make a focused effort on really slowing your exhale, especially when you're doing that pursed lip breathing and you're blowing out the candles. That can help to make sure you're not over breathing. And, breath work in general can cause a little bit of anxiety for people if you're just starting some breath work because you're paying attention to something that is so vital to you and your lungs may not be working great. So it might not feel good to do this deep breathing and feel like, I'm working really hard. I don't feel like I'm getting more air. So if that happens, we don't want to force a breathing pattern. Okay. We don't want to force a breathing pattern just because it's supposed to be better for you. You should breathe however feels natural. And if you can gradually start to use more nasal breathing for your inhales and start to use more pursed lip breathing for your exhales, that generally helps you to get deeper breaths, slower breaths. But if it's causing panic and anxiety, stop what you're doing and just go back to your regular breathing. It's, breath work is like any other exercise. If it's new to you and it feels unfamiliar, it might not work right away. You might need to practice. You might need to practice for a number of weeks before it starts to feel like you're really gaining some benefit and like you're starting to really understand just kind of how that feels. The other thing you can do is if you have a finger oximeter, you've got a finger probe, right? Put one of those on and then just do a little test and see what your saturations are like if you're only breathing in and out through your mouth. And then see what your saturations are like if you're smelling the roses and blowing the candles. That should kind of slow your breathing down, and that should theoretically keep your sats the same or improve them slightly. Um, Hopefully that answers your question.
Okay, perfect. Thanks. We have time for one more question. Does anyone have any questions for Jenny?
I just have a comment that we really, really appreciated your presentation. It was
Oh, thank you.
very well done, especially the anatomy part. We really
Good.
appreciated that. So thank you very much.
Well, thank you. I love hearing feedback about my presentations and especially the education because, I was kind of mentioning to Jamie before, a big gap that I see with a lot of patients, not just lung disease, but all kinds of medical ailments, is people don't really understand how their body works and how it should work, what normal is, and what happens when your body isn't functioning normally. But gaining that understanding and learning and understanding how things work and how they should work and what you can do to help, that can be a really powerful tool in managing your disease because that can really sort of empower you to know, okay, this is what is happening on the inside. This is what my lungs are doing. This is what my diaphragm is doing. That makes sense why this feels this way and why this feels that way. So I think just knowing how things work and why is half the battle. Once you have that under wraps, then you go and begin some exercise.
Yeah, that's great.